Basically, the two important types of diabetes is type 1 and type 2. Type 1 diabetes is commonly seen in the younger age group, children, which accounts for approximately 5% of the diabetic population. Whereas type 2 diabetes is much more common. It accounts for 90% of the diabetic population. See, type 1 diabetes is more common in children. Actually, it is also called as juvenile diabetes or insulin dependent diabetes.
Hi guys, this is Minidwan and you're watching HealthSite and India.com. Today's topic is something which is way too important for us to function a healthy life. Diabetes in India, what's the difference between diabetes when it comes to different age groups, and a lot more. And to talk on that, we have with us Dr. Pradeep Mahindrakar, MD Consultant Pathologist, Metropolis Healthcare Limited. Hi Dr. Pradeep, how are you?
I'm fine. How are you?
I'm doing great, doctor. Doctor, to begin with, I think the very first question right now that comes to my mind is, which type of diabetes is more or perhaps most common in India?
Yeah, before to answer this question, I would like to say in short brief what exactly diabetes means. See, diabetes, it's a very complex disorder. In fact, I would say that more physicians and then endocrinologists, pathologists, they are studied so vast and still they are confused exactly how to manage the diabetes. And sometimes it becomes very difficult to diagnose very early diabetes. So what exactly diabetes means, any person whose blood sugar level is, or you can say glucose level, is too high as compared to the normal range is considered as a diabetes. Now, what this glucose or sugar it's come from? It's come from food what we eat regularly. That food, it gives glucose, which is nothing but energy. This energy is given to the cells or tissues of the organ of the body to function. So the insulin, which is secreted by the pancreas, it plays very important role to regulate our sugar level. Its function is to take this glucose energy and supply it to the distant cells in the tissue. If there is anything disturbance in the insulin, this will give rise to sugar level. So basic thing is insulin. Insulin, in some cases, insulin is less produced or decreased, or if insulin is normally produced, but if it is not utilized, this will land up in diabetes. So this is just brief introduction of diabetes. To answer your first question, that is which type of diabetes is common in India. See, different groups, they are classified different types of diabetes. Type 1 diabetes, type 2 diabetes, 3, 4, 5, 8, and steroid-induced diabetes, gestational diabetes, moody diabetes. So there are different types of classification has been done. So basically, the two important types of diabetes is type 1 and type 2. Type 1 diabetes is commonly seen in the younger age group, children, which accounts for approximately 5% of the diabetic population. Whereas type 2 diabetes is much more common. It accounts for 90% of the diabetic population. And the rest 5%, what I just said, steroid-induced or gestational diabetes or moody diabetes. So these account for the 5%. So most commonly it's type 2 diabetes seen in India.
Also, having said that, doctor, does the normal blood sugar level vary with age?
Yes, it does. See, as the age progresses, the sugar level keeps on fluctuating. There are so many reasons. As the age progresses, there will be decreased physical activities, increased weight gain, there will be increase in the cholesterol and triglycerides, and some sort of comorbidities which accounts for increase in the sugar level. If you can see the younger age group, or if you see the age of 5 to 8 years, the fasting blood sugar is up to 120 or 140. It's considered the normal. Whereas in older age group, if it is crossing 100, we should take care. So it should be less than 100 milligram per deciliter.
Since we're talking about age group, are the symptoms of diabetes in any way observed differently when it comes to different age groups? Let's talk about per se children, adults, or people who are in their old age. Is there any difference?
See, if you consider symptoms of diabetes, which is commonly seen is polydipsia, polyphagia, and polyuria. Polyuria means the frequency of urine. You're passing large amount of urine. Polyphagia means the person feel very hungry. It's all the time the person feel like to have eat something to eat. And polypsia means increase in the thirst. So he keeps on drinking the water. These are the three basic symptoms which is seen in the diabetes. There are other things like weight gain, then skin dryness, itchiness, increased chances of getting infection, urinary tract infection. These are all symptoms. Usually in children and adult or old age, the symptoms are more of same. I mean, it doesn't vary. Only thing in children, you will find the symptoms very early compared to the adult and age group, old age group. The other one important thing is that the symptoms in children, you will find the bedwetting, which is more common. So if the child is doing repeated bedwetting, it's the early symptoms that the child may have diabetes. Otherwise, the symptoms more of children, adult, and old group is same.
But if we talk about children specifically, doctor, which type of diabetes is mostly common in children and what could be the possible causes?
See, type 1 diabetes is more common in children. Actually, it is also called as juvenile diabetes or insulin dependent diabetes. This is because of the insulin is very much decreased or production is not happening. There's so many reasons. One most important reason is autoimmune disorder, which is a self-induced disease which produces antibodies which kills the beta cells of pancreas, the organ which produces the insulin. So when there is a damage to the pancreas, the insulin secretion goes down. Once the insulin secretion goes down, definitely the sugar level is going to increase. So type 1 diabetes is more commonly seen in the child age group.
If we talk about in particular, in general, if we take all the three age groups per se, children, adult, old age, so who are firstly, more adversely affected due to diabetes? Which age group is the most affected and why? Because we all know that diabetes is not completely treatable. So if we categorize it into different age groups, then how, who, and why?
See, younger age groups are less adversely affected. They are because they are younger age group. The older age group, as the age goes on increasing, like 40, 50, 60, 70, above 70 years, the person will have another added diseases like hypertension. It's not exactly disorders like hypertension, then weight gain, and these all old age group people, they have got less physical activities. They do less physical activities. Above that, they will have a lot of cholesterol stored in body, triglycerides stored in bodies. There are additional diseases like some disorders related to the kidney or liver. These are all factors, along with diabetes, which adversely affect, later on give rise to complications like nephropathy, uropathy, or retinopathy. That is early, you can develop early cataract if the person is long standing. And this is the reason because this older age group, suppose if the start age at the 40, they are more exposed or longer time exposed to sugar adverse effect. So elderly people are more adversely affected compared to the younger age group.
And doctor, any advice or suggestion from your end in order to keep safe or perhaps prevent diabetes?
See, as such, in children, when the type 1 diabetes, if you talk about, it's very difficult to prevent because it's autoimmune. You exactly don't know what is the cause. Another cause can be family, genetic related. So these type 1 diabetes is very difficult to prevent, which is seen in the young children. Whereas type 2 diabetes, definitely there are very much scope to prevent. Like for example, if there is a family history, so you should take the child or younger age group, they should take precaution. They should do regular physical activities. They should avoid unhealthy food. They should avoid sitting at one place, like watching video, mobile or video games or a TV. So sitting at one place for the constant long period should be avoided. So have some physical activities, have some healthy food, and then you should concentrate something like on the mind, which is definitely gives some benefit to prevent this type 2 diabetes.
All right, doctor, I think this has been very, very insightful. Thank you so much for joining us today.
Thank you. Thank you.
Thank you.